All right, if you can make sure that your mic is muted, we will go ahead and get the meeting started. So we'll start with Amy sharing.
Hi, everyone. My name is Amy Gothier. I'm the Deputy Director of Housing, and looking forward to a great year. And it's really nice to be able to see you all and to be here with you. We were actually very appreciative of the email that was sent. I think that what all of you have taken the time to do is really be able to write heartfelt message that really identified, I think, some of the questions that you still had and some of the concerns that you have. So what we wanted to do as a leadership team was really not waste any time, but to get you folks here in front of leadership team, not only in housing, but within student life, to be able to answer any questions and make sure that some of your needs were addressed. This will not replace a written response. So I want everybody to know that we do anticipate in responding through an email, but we just felt like this would probably offer a better opportunity to address some of your needs sooner. We also really wanted to make sure that we heard directly from you and not hearing through a number of different levels. And so this is why we wanted to make sure that you folks were invited, not necessarily to have to share your feedback through a hall director and then up through the leadership chain. And so that's why all of us are present here and members of housing haven't been invited with all of the different layers. We also, at this point, want to be able to just take a minute before we start to think about and name, I think that some of what you all may be experiencing, particularly thinking about the events that happened in Wisconsin today. And we know that there's harm and impact due to that. And we just want to make sure that we put that out there, that we recognize that this is a difficult time, not only dealing with a global pandemic, opening our buildings, but then also thinking about the racial climate in terms of what's happening with Black people as well as people of color. So we put that out there. Want you to know that resources are here. So if you would like to talk with any of us or with your supervisors about that as well, we're happy to do that. At this point, I'm going to turn it back over to Jasmine to talk a little bit about the structure of the meeting today.
Great, thank you. So my name is Jasmine Clay. I serve as the Director of Residence Education here at Michigan. So our meeting today, we're going to start with speaker introductions and comments. They will share about 5 minutes of information with you just from their role and their perspective. We will save time at the end for audience questions. You can unmute yourself if you are comfortable or want to vocalize your question. You also can private message within the chat feature, and both Amy and I will be moderating what comes up through the chat to be able to share the questions out loud within this space. We do ask that you are conscious of just thinking about from a timing perspective. We have about an hour today, so we're asking if you can limit your comments to about a minute. We'll be requesting that our speakers do the same. Okay. We will go ahead and start. So there are just a couple of chats already right now. We will send a follow-up. So this meeting won't be recorded, but we will send a follow-up email, as Amy alluded to before, and just based on just some emails and things that were sent to us before, the chat is private based on request. So we will go ahead and start with speaker introduction. So they will introduce themselves and share some words with all of you as well. We will start with our Vice President of Student Life, Dr. Martino Harmon.
All right. Thank you, Jasmine. And I want to say good evening to all of you and thank you for speaking up, speaking out, and taking time to be with us. I haven't met many of you, or probably hardly any of you, in this virtual space that we're in, but I hope to meet you at some point. But if you look around campus, there are pictures of me with a mask and a little gray afro. So if you want to know who I am, just go by the pictures. But I do appreciate you raising these important concerns. It's critically important that we hear from you, but that we also respond to the concerns. I understand you're on the front lines. You are working, with students. And I can understand your fears, your anxiety, your concerns, and your needs to be safe. Completely understand that. I want to say one thing at the onset. I know in the letter there was a reference to concerns about retaliation, and I want to make this really really clear. Anyone expressing concerns about health and safety will not cause any reflection on your appointment, your position with residents' life. Retaliation against any employee who expresses concerns, whether it's formal or informal, is prohibited and won't be tolerated. So we need to hear from you. We're focused on you doing your jobs. That's what's important, but we also want to hear from you about your ability to do your jobs. I want to just mention a little bit about safety. That is our number one priority. And this is a really complicated set of issues because, we're trying to make this public health fall forms residential semester work. And it involves, a lot of work that people have been doing for months to help make you, students, staff, faculty safe. But I also want to say, without straying into the health folks lane, that there's no 100% risk-free scenario unless you just go into a personal lockdown. But we want to mitigate risk. That's our goal. And I think about when I go into the supermarket, I have health issues and I worry and I take a risk every time I walk in. But I look to see, do people are they wearing masks? Do they have proper distancing stickers on the floor? Do they wipe off the baskets and the carts? So I look for those mitigation factors, and that's really what we want to talk about, is how we came to where we are today, and potentially what we can do better if we can identify things. But also, I want to mention too. I know there were comments and concerns about what if we close, what if we pivot. There are no plans to pivot, at this time, none whatsoever. President Shaliso and leadership and everybody involved went through a lot of discussion, a lot of deep thought, a lot of checks and balances to make sure that we can do this. Now, the future is not guaranteed. We don't know, if our students will follow the culture of care and will be safe, or, there are things that we just don't know. And if we get to a point where we see things have turned south, then we will pivot. And there's a lot of ramifications in that. But safety is first. And if that happens, and we're already in discussions at a high level about what if that happens, we will get back to you and we'll let you know how that impacts you. But our goal is to make sure that you're safe, but also to make sure that you're taken care of. So I just want you to know we don't plan to pivot, but as things go on, we just have to monitor the situation. So with that, that is all that I wanted to say. And I'm, again, excited to be in this space. And I'm not sure who I'm passing it to next. So I'm going to go back to Jasmine.
Thank you, Dr. Herman. Our next speaker will be Camby's Kaleli, who is one of our associate vice presidents.
Thanks, Jasmine. It's great to see everybody, over 100 people here. So my name is Camby's Kaleli, and I'm the Associate Vice President for Auxiliaries, which means that housing actually is one of those auxiliary operations that reports to us. It's good to let you know that I have some information to share with you that might be important. But before I do that, I want to just let you know that we read your email. I read your email, and I want to let you know that we hear you. We understand your concerns, and we're there with you. As a former director of housing for a decade or so, I've been involved with a lot of RAs in my life, and student employees and student workers and student leaders within housing. And so I appreciate your feedback, and hope that we can answer many of your questions and and let you know that we did hear you. That's the most important thing for me. But first, before I start, I wanted to share with you a couple of things to put things in context from my perspective, as I was thinking about, what am I going to say? I know that there are a lot of informations out there in the social media, some rumors, some facts, but you don't know which is what a lot of times, and it's very difficult to siphon all that. There's just so much information coming our way. Our schools are not the same. We have different regions in the country. Each one is dealing with the COVID in a different level. And as a result of that, it's not a good idea from my perspective to compare our situation with others. We have to look at our situation here. Now, having said that, and I want to share with you that one of the things that I read in the letter was your concerns about diversity, equity, and inclusion. Because of the student-centric culture of student life and housing, we understand that COVID disproportionately impacts our students of color, our LGBTQ community, and all other underrepresented communities within the house. We understand that home insecurity is real. I've asked our new director of housing, Rick Gibson, who's joining us today, and today is his first day, by the way, on campus. Welcome, Rick, to help me answer these questions for you and to identify a long-term plan for us to be able to address all these issues. We're exploring all that. And let me emphasize that we're exploring all that and also your employment questions if there is a pivot. If there is a pivot. As Dr. Harmon said, there is no intention at this point to do any kind of pivoting, and we're moving forward as planned. Starting tomorrow, in order to also answer one of your questions about communication, we're going to have a daily COVID update for you for the next 2 weeks. That way you know the latest and the greatest of what's happening within the housing, and hopefully all the information that you need to know that would help you to become comfortable with what's happening within the community. We'll continue that for the next 2 weeks, and then after that, switch to having this on a weekly basis for the remainder of the year. So hopefully in this format, we can address your communication issues. There are also a number of concerns about the decisions that we have made here in housing. And I want to share with you that in a public health environment, housing cannot make any unilateral decisions. We have to communicate with our partners, our public health, campus public health leaders, our environmental health services, EHS folks, and they weigh heavily on the decisions made by housing. That's why two of our panelists today are coming in, Dr. Robert Ernst and Danielle Sheen, to provide some insight in those areas. I'm available to answer any questions for you once we have finished our introductory comments, and looking forward to seeing you on campus in the next few days as a walk around. Jasmine, back to you.
Thank you. Our next speaker is Dr. Rob Ernst, who is another one of our associate vice presidents.
Thank you. Yeah, I would also identify as a faculty member in the School of Medicine and practicing physician at Michigan Medicine, where I see patients, in addition to my administrative roles, overseeing the health service on campus and some of the other health and well-being units on campus. I'm also a parent of a University of Michigan undergraduate student, so invested in the safety of the entire community. As I've been connected to the work of preparing the campus for a residential experience this fall, I've been real impressed by the president and the attention to the core work of the university, both providing healthcare, conducting research and doing the important teaching mission. And his consistent message around the importance of the co-curriculum has really been, I think, impressive. You know, as Dr. Harmon has pointed out, it's not a zero, you know, risk proposition, you know, but to get on with the core work of the university, there's been a lot of attention towards mitigating that risk and trying to create the conditions so that doing a residential fall semester approximates the risk of going about our daily lives in a sort of COVID environment that I expect is going to be with us for a while, you know. So the campus has spent much of the summer with a strategy designed to inform both the academic calendar and the academic offerings and trying to address important issues of density on campus, while also has stood up a public health team that was chaired by the dean of the School of Public Health, and we had a number of really, you know, impressive public health professors on that committee. Many of these are the same folks who advise our governor, and I would offer that I think the state of Michigan has been, you know, really one of the more science-informed kind of states in terms of mitigating risk of COVID, as evidenced by the fact that we're currently, I think, ranked 43rd in terms of our case per million daily average, you know, had an early spike. And I think we've learned a lot about this illness and how to mitigate the risk through our experience since March. Some of the things we know now that we didn't know then are that, you know, even though the science suggests you can find the virus on aerosol particles and you can find it on surfaces, we've really learned that this is an infection that passes from person to person through close contact. You know, when we talk or sing or yell, we create sort of a cloud of aerosol around us, and people who are carrying the virus have that in the cloud around them, you know, and if the clouds sort of get into somebody else's cloud, you're starting to experience their aerosol. And that's, I think, the nature of how the virus spreads. And the other thing that we've learned is that even, you know, though when people are symptomatic, they're really shedding a lot of virus, there's virus that can be shed, you know, when people are minimally symptomatic. But that informs some of the mitigating strategies that we're recommending. And we've shown that these are effective. So universal masking and distancing strategies are really effective at reducing the likelihood of transmitting the virus. And that's why over the summer, as we've reactivated many of the research labs, have had a number of folks in housing year round, and certainly have never stopped the providing of healthcare to people, many of whom, you know, of us on the real front lines with COVID, you know, have really trusted these mitigation strategies of keeping spacing and wearing masks. That's really the most important things we can do. We've also identified some of the really more important kinds of events that can transmit, and big gatherings inside, you know, close contact when people are yelling and screaming and singing, you know, at least making more aerosol. These are the things we've learned about the infection, and some of the strategies that have been designed to mitigate the spread of that have been shown to be effective. You know, we had have had that experience in both the healthcare and the research folks. So I'll say that these are the approach has been not unilateral, as Kambiz Khalili had sort of articulated. You know, the coordination of the environmental measures to create distancing, the approach to reduce the density, a real insistence on watching for situations and spaces that don't promote spacing and physical distancing, as well as the sort of universal masking strategies, were all informed by these public health teams that ran up the recommendations to the COVID leadership team and the executive officers. I will also offer that you know, the strategies are not just based on the people. I mean, we have a guidance that comes from the CDC and the American College Health Association, other guidelines that really inform these practices and these strategies that are put up. But, you know, at the end, you know, as Kimby's also mentioned, a lot of schools with different variations on some of this based upon their local environment. I think we are really advantaged, for instance, by our proximity to the academic medical center. Super advantaged by the state, which has enacted a universal masking mandate. Very advantaged by our local health department, which has enacted a city ordinance that further restricts the number of folks who can gather together at any given time to 25 outside, 10 inside. These are really focused strategies that are grounded in science at reducing the likelihood of transmission. So I think that's the landscape that gives us the shot at preventing spread. I know a lot of the comments have been put in there about testing, and I know that's been where some of the folks have been latching on to some of the institutions that have really taken a local sort of blanket approach to massive testing programs. You know, I'm rooting for them just like I'm rooting for us. I mean, they have access to, they've created, you know, homegrown assays for this, and the landscape is shifting a lot. Yeah, I will tell you, if a school our size and scope that had, you know, the number of folks that we have here were to try and adapt a strategy that some of these other schools are saying that they're going to try and roll out, you know, that would involve doing more testing than is done in the entire state of Michigan on any given day. You know, so the capacity issues are very real, and the recommendations are not really built into the CDC's current recommendation, which is to prioritize the testing resource to make sure you have that test first and foremost available for folks exhibiting symptoms and getting them quickly addressed to try and remove people with the illness out of the environment and connecting them to isolation and quarantine, and then really focusing on a tight contact tracing, you know, strategy. And then we have a targeted strategy for surveillance that has included a pre-arrival testing program for folks living in housing. And, you know, I think that's been the strategy that our public health experts have given to us to try and stand up. And I think we'll continue to evaluate that. I will
Thank you, Rob.
pause for now and kick it back to Jasmine.
Thank you. We've
And
gotten quite a
Director
few
Clay,
messages
excuse me.
about having time for students to talk. So we have one
Director
more
Clay,
person who
yeah.
will share.
Could I ask that we please honor the 1 minute restriction that you mentioned at the beginning for introductions, and then we can get as quickly as possible to the actual questions and content that we wanted to discuss today?
Yes. So just to clarify, we were asking the speakers to share about for 5 minutes, but we'll introduce Danielle to share some words, introduce Rick, who's our housing director, and then we'll move to questions. So next up briefly is Danielle Sheen, who's the executive director for environment, health, and safety.
Thank you. And it's great because most of what I wanted to cover has been covered by others, but I did want to say that I do appreciate the concerns being raised. That actually made me feel really good. That shows me that you guys are taking this seriously and that you care. And so really that's at the heart of the culture of care. And I perceive this as a definitely a positive thing, that you guys are concerned and wondering how these decisions were made and where this information came from. So just quickly, you know, Rob mentioned the public health, I think experts. I, from EHS, and Rick Neitzel from the School of Public Health, kind of worked on a lot of the operationalization of some of those ideas. And so that's much of the work that we've been doing this whole summer. And I guess I will leave it at that, but I think that's probably most of what I wanted to say. It's a multi-layered approach. I think there's a lot of different pieces to this. There's you know, as Dr. Ernst was mentioning, there's a lot of different aspects, and we're trying to kind of cover them all to minimize the risk as much as possible.
Thank you. Rick, would you like to introduce yourself briefly before we move to questions? And I think Amy's going to start with the questions that came through the chat.
Yeah, just very briefly. Again, my name is Rick Gibson, and I'm your new director of housing. And it's my pleasure to be able to participate in this evening. Today is actually my first day on the job. But with that said, I'm actually very excited to be able to hear from some of the staff, even though I haven't had an opportunity to meet a lot of you. I'm very concerned and interested in what you have to say about your lived experience on the job and how you're being safe and serving students. So I'm not going to share a lot right now, but hopefully you'll have an opportunity to meet me virtually or in person at some point in the near future. And I look forward to engaging with everyone in a very meaningful way in the future. So thank you.
Thank you. So just to acknowledge the feedback about providing more time for students, we do have some other people who are on the call who will pop in and answer specific questions, but in the interest of creating more space for all of you to ask your questions, we will not have them introduce themselves unless a question for their area specifically comes up. Amy, do you want to?
Yeah, there was a question that has come up, or not necessarily a question, but a statement a couple of times, and it sounds as if I know many of you were hoping that we would be able to respond in writing to reiterate that there would be no retaliation against anybody who wrote the letter, or participated in the writing of the letter, or participating in this call. And I want to assure you, just as Dr. Martino Harmon talked about, there will be no retaliation. That's not something that we believe in here. And so we want you to know that any question you ask is a safe question to ask. And again, we're very fortunate, I think, to have such invested students. So you will receive something in writing, but we wanted to make sure that this conversation was able to start first. One of the first questions that I have is regarding international students. And so I'm not sure who would like to respond to this, but the question is regarding international students who were asked to participate in enhanced social distancing when they arrive. And so maybe we can then talk about why some of the domestic students from hotspots have also not been asked to engage in enhanced social distancing once they arrive. Okay, Rob.
Real quick, I mean, that was, again, an example of following the playbook from the CDC, where the CDC had, at the time the recommendation was put out, had specifically identified travelers from international destinations as being at higher risk. I think it's a good example of how the landscape shifts, and just within the last week, the CDC has adjusted that recommendation, and I thought the FAQs on the Mason Blueprint website have already maybe been updated on this. Whether or not that's there now or not, I can tell you has been within the last week. The CDC recognizes sort of all travel as being a risk factor. So mixing and movement is a risk factor. So we've dropped that requirement that international travelers adhere to an additional time frame of enhanced social distancing. So that's reflected in the FAQs.
Thank you. The next question, oh, I just lost it. Sorry. Does no plans to pivot mean that at this point we do not intend to go virtual, or that in case it becomes necessary, we don't know how we will do it? There is another question that is very similar, that is specifically asking about if there is a pivot, what does that mean for specifically to ResStaff in their positions?
Yes, thank you. So as I mentioned earlier, and Kim Bees may join in on this, we recognize that there's a possibility if things, really turn bad, that we may have to pivot. And I've asked the leadership within student life to start looking at that. What does that mean for not only residence life staff, but for students, for other departments? And we have a whole list of scenarios. Again, we're not planning for a pivot that we know will happen, but we're planning in case a pivot does happen. In terms of what will happen with employees in residence life, that is a big part of that plan. I'm not able to give you specifics about that right now because we haven't really worked that all out. But what I will say is, you know, if there was a pivot on Friday, we're not going to tell you to pack your things and go. We would certainly try to figure out what's the best way to approach that, and you know what type of work would be needed. And so again, you know, I don't want to go deeply into it because we haven't worked all those scenarios out, but we are doing starting to do scenario planning in case we have to pivot. But you know, as I said, you know, the president made a big decision that we're moving forward. So we're not moving forward with a plan to pivot, but we also know that we're watching the indicators and how things are going from a public health perspective. And if for safety reasons we have to pivot, then we'll do that, and then we'll be ready from there. But I acknowledge that that statement comes with anxiety. You know, you're not sure what that means, but I can assure you that we're working very hard to make sure we have those plans in place.
Excuse me. I think we all really appreciate everything that you guys have said so far, but responding to individual questions is not going to be the most productive way that we can address the issues that we sent to you guys in the letter that we as a group composed. So if you are able to go to that letter and look at our action items and address those bullet point by bullet point like we wrote them out, I think that would be what ResStaff would appreciate as the most productive use of our last 25 planned minutes of this Zoom call.
How about John Healy, if you're comfortable introducing yourself and maybe talking through some of the facilities pieces?
Sure.
Because that is one of the next questions that came through the chat as well, was about plexiglass barriers.
Sure. So my name is John Healy. I'm the Director of Student Life Facilities. I've read through your letters and have formulated responses to your questions, which I believe will be transmitted back to you, as Jasmine said earlier in this presentation. Some of the items that you talked about were plexiglass barriers and restrooms. We, in conjunction with EHS and Dr. Ernst, read through the CDC guidance and made the decision not to install plexiglass barriers in the bathrooms, that we would depend upon student social distancing while in there. Other questions centered around additional hand sanitizing stations. We agree, or we have installed more than 150 to date. We have another order of hand sanitizing stations that should be in this week that we will disperse throughout the residential halls. There's questions there about installing paper towels in all restrooms. Through the course of the summer, we did install paper towel dispensers in all restrooms. If you're aware of some that do not have dispensers, please let us know and we will get them in there. There was questions concerning water bottle filling stations. To our knowledge, all residential halls that have students in them, with the exception of two, which are Martha Cook and Henderson House, have water bottle filling stations. There's a program several years ago to install the bottle filling stations within the halls. And operating again off of memory, maybe you take it back to you, Jasmine. Let me find the letter and I can address the other items that may be in there.
How about we go to Rob next? There are questions from the letter and questions in the chat about access to healthcare and testing for student staff based on their roles.
Well, the University Health Service has really done a lot to streamline its operations to try and be what we expect will be a lot of demand for evaluation and management, assessment, testing for folks that are concerned about the possibility of COVID. We again have staffed up a front end sort of triage line and are using video visits to sort of get people to really contact us in advance, not to just show up at the health service. I think a lot of worry about folks being in the building, and possibly exposure there, which is a concern. But what we've done is coordinated specimen collection at the power center for the most part. So we'll use that as a place with all summer, and in the spring we were using tents outside for specimen collection. But unpredictable weather, either excessive heat or rain or cold, made us sort of move into an arrangement where we stood up the power center as a specimen collection area. So if folks are concerned, they should contact the health service, get a quick assessment, and then a time and a space to get the nasal swab and sent to the lab across the away at the medical center, where we're seeing less than 24-hour turnaround. We're working really in terms of the isolation piece, with housing to try and get people out of circulation in those cases. And that's being coordinated with Dean of Students and some of the folks in housing to try and get the folks in the isolation and quarantine spaces that have been designated. So health service should be regarded as the point of first contact for folks who are interested in assessment, evaluation, and testing.
So does this mean that a resident advisor needs to be symptomatic in order to get tested? Because I feel like it would make sense for ResStaff to get tested on a regular basis, since we are on the ground supporting residents every day.
I know it's been again, there's a lot of different models that are out there. I know, if you look in the Big Ten, there's a couple of places that are doing and proposing massive sort of testing across the board kinds of models. Most of us are in the middle here, where the emphasis is on prioritization of folks who are symptomatic and as part of contact tracing. Like I say, it's not an unlimited resource, and the trade-off is turnaround time for getting the results. So that may change as the resource becomes more readily available. We have in housing specifically targeted some asymptomatic screening on the way in, as was recommended by the public health team. And that's a program that went off, I think, really well. It was tough. It was because of the roster was changing on a day-to-day basis and trying to get that coordinated. But ended up testing almost 6,000 people and had an extremely low rate of positivity. So I think we only found 20 people who were positive out of 6,000 folks who were screened on the way in. We do have plans to do a catch-up, as was recommended by the public health team, after a couple of weeks, and reassess the environment. But again, I'll say, the notion about doing a lot of testing is something that we hear about from some folks, but there's a lot of different models out there. And I can tell you about even the rating of risk is, variable, and is, we don't test the healthcare workers, nurses and doctors and things who are really, seeing folks. They're not tested on a real. I've never been tested. I go to the hospital every week, since March. And many of my peers also, have never been tested. So it's taken on a sort of a make sense kind of thing, and maybe we'll get to a point. I think it's certainly as validated tests become more widely available, I think that it may, the guidance is going to shift. But the public health folks here have been focused on the prevention models. Having a test doesn't prevent getting COVID, but the social distancing and masking strategies do, and we know that. And testing holds a role for diagnosis, assessment, and contact tracing.
Thank you.
Thank you. Wait, I
So
do want to state that there are graduate students.
That was my next comment.
Yes, and we did have some concerns as well, and I'm wondering how they will be addressed, because the dorms are a little bit different.
Thank you. So I just wanted to bring up that there were 2 letters that were received. The MLive article and the recent letter were the ones from our undergraduate students. So I'm wondering if John and Danielle can speak to some of the EHS pieces and the facilities pieces, specifically within our graduate communities. I know that about a month ago, John and I met with some Munger students as well. So if there are pieces around Munger suites that you can share, or thinking about how things look a little bit different in our Northwood apartment communities, that would be appreciated.
would offer at the Munger Suites and the Northwood Apartments. In both cases, the intent is for the residents to be responsible for the cleaning of their own restrooms. We acknowledge that there's community spaces within Munger, and those two have traditionally been cleaned by the residents. So in many ways at Munger and at the Northwood Apartments, what has occurred in past years would continue to occur. The residents remain responsible for those apartments. Maybe Jasmine, if there's a specific question there, I might be able to address it more specifically than just generalities. I'm not aware of the graduate student questions.
They're similar to the ones that came up around PPE and cleaning pieces. It looks like Danielle unmuted. I don't know if there are things that you would want to share.
I didn't see those concerns either, but do you mean specifically for cleaning the PPE, or do you mean I'm not.
Shared suites. So the shared suites of 5, 6, 7 people sharing a kitchen.
Okay. Yeah, I mean, I think that this is very similar to me, like an office space. So I have people in the office working, and we're using bathrooms, we're coming in and out, we're taking keys, we're using shared vehicles, things of that nature. So it's really about setting up a shared responsibility for that. We have logs, and we go through, and basically twice a day we go through and we have different people assigned to different areas, and they check off that they're doing the cleaning. So I would think we would, a group could simply set up something very similar to that. Everybody keeps up with the cleaning. Hand washing is always, right, a very important thing. So even if I'm out and I go to use the copy machine, I go and I wash my hands. So, I mean, I think those two things together, the cleaning never hurts, but from a personal responsibility standpoint, I'm either using hand sanitizer or always washing my hands after using shared equipment as well.
Okay, unfortunately, we still are not proceeding in a way that has addressed anywhere near the majority of our concerns that we sent you. So we would like to request that this meeting is extended, or that we have another meeting in the future. And going chronologically by our bullet points, we've covered around the first 3, although I'll admit I'm not satisfied with just saying that we won't and that's it. But then that brings us to 3E. Will we be locking public lounges and community spaces, or removing furniture from those spaces in all dorms?
Right now, I'll go ahead and answer that. In all the dorms, there's approximately 125 study rooms and lounges. And of those 125, approximately 50 of them can be locked, and certainly they will be. The other 75, intent was not to lock them, but to sign them and put up stanchions and barriers in front to note that they are in fact closed. It should also be noted there's many places within the halls themselves that are open that can't be locked in the first place. So certainly it's going to take some student behavior and a culture to respect the signage, if you will, of what is currently opened or not opened. We did go through the process of de-densifying some of the furniture throughout the halls, certainly the larger pieces that were moved out, and the smaller chairs that could easily be moved out. We put all of them into storage. Some of the other larger pieces we spread out, if you will, to ensure that they were properly distanced. Maybe you could expand on some of your thinking of the urgency of that, or maybe dig deeper into some of your exact concerns as it centers around the closing of those lounges.
I think Munger is a good example of how this has been going on throughout the summer. We also shut down our lounges and put caution tape up, and we're still having residents consistently in those spaces. So it's great that you're saying people should have a personal responsibility, but we're the people that are actually on the ground seeing what residents are doing, and we live in these spaces, and we see very clearly that residents are not respecting the signs that we've put up or the safety guidelines that have been implemented.
I also want to add on that will there be another meeting, because we have 13 minutes left and there's just so much to address, and we spent half an hour with introduction. So that's just one question. And then another question is with accountability, like there's like, yes, we see the residents, and yet like you can put out caution tape, but we've seen like other universities such as OSU and Penn State like have consequences. So will University of Michigan like think about if this is a route that we can take? Yes, there are many models, but this is one of them too. So that is just one of my questions. Thank you.
I don't know who's going to answer, but I know you're anonymous, but just want to acknowledge the pain that I feel like I hear in your voice. And so I know that I think we say a lot that we appreciate you all's work. We wouldn't be able to do this without you, but I feel like this moment would be remiss to not acknowledge what I hear is concern and pain and care and passion in your voice, whoever you are. So just wanted to take a moment to share that.
I agree with that. I also want to reiterate a couple of comments have come up again in the chat too. This conversation does not mean that we are not going to be responding in writing. We will be responding in writing and going point by point to make sure that you have all the answers that you needed. We really did want to be able to talk about, some big picture items, but I do understand the need for us to go through some of those items. And so if we're still landing on question 3, I know there's a question about PPE and the amount of PPE that will be ordered for ResStaff, and we have worked. I think maybe I'll take a stab at this, and then others can jump in as
real
well.
quick before real
Mhm.
quick before you finish asking this, I just want to point out that the anonymous person just asked a question about what type of punitive measures will housing continue with when people are not adhering to health codes. I just want to say sorry to all the RAs for taking any time. I understand why all of you are saying thank you for doing this and thank you to the RAs for doing that, but it simply is wasting time to do that when we really would appreciate it more if you would answer our questions. And so with that, I would say, can you please answer the question of what type of punitive measures? The last meeting that I was in where I asked about this, housing said that we will be working towards using restorative practices, but that concerns me considering that this is a literal life or death situation for many people. And in the past 4 years that I've worked with housing, restorative practice is great in concept, but there have been many cases where many people have been harmed significantly in the community and nothing is done to actually repair that harm. And if that continues, I'm very concerned about the health and well-being of many of my own residents.
To add to that, real quick, sorry, to add on to that, just as if you could please answer that question, we would all really appreciate that. And also to save time, if you could please just tell us if any of the action items on the letter will be met. You are calling them questions, they are action items, and we are just asking if any of those action items will be met. If you could please just answer that with a yes or no, that would save a lot of time. Thank you.
Along with that, can I also ask whether these action items have a timeline or not? Because I think I speak on behalf of a lot of staff that move-in week is one of the most dangerous conditions we're going to face. And if we don't figure that out now, and if we don't have PPE ASAP, we're not going to be safe doing the work that we're expected to do. And that personally makes me feel unsafe. And I'm assuming it makes a lot of other res staff feel unsafe because a lot of us don't have protection from this virus that we can bring on our own, like face masks, face shields, and stuff. This is all stuff that we should be provided, and soon as well, especially considering move-in has already started.
I would like to add on to that and express to people in housing that may not understand part of the reasons that we are so concerned. These are just two examples from one array of concerning things that have already happened in my week being here. But the fact that our online training specifically told us not to enforce the guest policy unless a resident brought up an issue with someone having an unauthorized guest in the dorms, that was really scary for me to read, knowing that that is the stance that housing is taking on having unauthorized guests that could come from anywhere into the dorms when we're supposed to be keeping that contact down. And secondly, that I was informed that during move-in, ResStaff would be expected to individually clean blue bins returned from residents who brought who knows who with them to the dorm to move in. And the fact that they had one guest with them, we don't know when or if they wore their masks during their move-in. And that did change, at least in my hall. I don't know about others. After expressing concern to my hall director, I am so grateful to my hall director and to all the hall directors for the work that they're doing. But those two things are just some of so many things that have happened that have really concerned ResStaff as to what's going on with housing during move-in and in general.
I'll also note that without widespread testing, at least directly after move-in, the development of outbreaks within the different residence halls is incredibly likely because, especially with so much of the testing being self-administered, they're going to be error-prone. And so without that testing right after the massive move-in, I can't even imagine the amount of outbreaks or clusters, as they like to be called, that are going to be seen within campus and that they'll go completely unchecked. And so if we have these without any significant mass testing, that who knows what students will be bringing to their families and to other ResStaff and UMich faculty.
So that was a lot of points that were just made from ResStaff to you guys to consider. And I just want to point out that this just shows how important it is to have an RA representative alongside you guys making these decisions, because we are the ones who are working on the floor and living in these settings to enforce these rules. And we have a lot of valuable input that could help prevent plans like these having many flaws.
And please consider the graduate resident advisors, because as we have clearly seen, I don't think a good chunk of you read the letter we sent to graduate housing leadership back in July. And we actually connected with Ombuds to put an official complaint because the communication and transparency has just really not been there since we started our role in August. So please don't forget about us. We are students, we are residents, we are adults, we are professionals, and we have worked with professional people. And unfortunately, this is not a professional setting that I support and that I feel supported with and that I can trust.
Candice, did you want to go?
Yes, thank you. I think I need to answer some of the questions here that came about. Some of them takes a little bit longer for us, but first, I want to remind folks that I put this on the chat as well, but certainly I think it's important for everyone to know that that in our written response, we'll put something about retaliation in there and that is not acceptable. So I want to make that very clear. It's just very sad for me when I'm sitting here and looking at these boxes in front of your names. I'm seeing a lot of anonymous versus seeing your faces. So hopefully we will see more of your faces in the future without worrying about trusting us and communicating with us, because I'm putting everything out there for you. In regards to other meetings, yes, we certainly will have another meeting. I can certainly be there. I'm hoping that we can answer some of your questions within the next few days, and hopefully before the end of the week to have another meeting to discuss the additional questions and the remaining questions that you have. Related to the conduct, our position has been always very clear. We do understand this is a dangerous situation. The restorative justice process is what we're using, but that doesn't mean that we're not going to do anything about the whole thing. If folks are not complying, their contract will be terminated, period. So we will be working on that, and hopefully you'll have some more detailed, specific information for you on that matter as well. So hopefully that will be answering that question for you. And regarding PPEs, many of the things that you have mentioned in your document, we already are in the process of either doing it or have done it. But there are some things that the information is not quite there for you. And so we want to share that information with you as well. And that's an area that I think, again, that communication is important for us. Last but not least, certainly, we want to have a voice of the RAs, especially during this time. In my previous work as a director of housing, we had a RA council, and the folks, the leads of the RA council on a regular basis met with the director. So Rick, I'm sure you'll be meeting on a regular basis with our RAs, and we will develop a process that we can get your voice in and make sure that you are involved in the process. We really, again, you guys are frontline. If you don't let us know what's going on, we can't do much about the whole thing. So it would be important for us to listen to you, and we do have to develop that trusting relationship so we can work together and make this, go through this process together. I just wanted to mention that. Thank you.
I'm sorry, I just find that hard to believe because the graduate RAs have been expressing our concerns since March and have had constant sending of emails, communication with nothing in return. And just kind of going way back to what another anonymous person said, I'd really like to see the timeline on when we're actually going to be listened to or when we'll be able to be a part of these meetings. Because again, we've been asking for that since March and have heard nothing about it.
I'll also say that the concern about being anonymous or not having or just not having pictures or names is because in the LOA, there's specific language to suggest termination if we directly speak out about a housing policy. So with language like that directly in our contracts, we're not going to be inclined to make ourselves easily noticeable to housing staff.
And I think it's worth adding at this point that we've raised so many concerns that, given the limited time frame we have tonight, that, those aren't going to be able to respond to tonight. And I understand that. But I hope that we can expect that all of these concerns have been documented during this meeting and will be responded to in the follow-up email, in addition to all of the points in the letter that was sent. And on that note, I want to add one more that hasn't been talked about as much in the letter or here, which is the inherent dangers and problematic concepts surrounding student staff being on duty. I think it's a really strange and unsafe notion that student staff without professional training should be responding to a variety of health-related crises. Now we have problems concerning social distancing and COVID-19, health-related concerns, but we've always had issues around alcohol abuse, drug abuse, mental health crises. These are things that student staff should not be responding to. And given the current climate surrounding law enforcement personnel, there's going to naturally be a lot of discomfort surrounding DPSS. And the best response we usually hear from housing when we're uncomfortable with the situation or feel unsafe is to call DPSS. But you have to understand, for many residents, that's going to make them feel less safe and less comfortable. So I would like to see some more specific follow-up about how we're going to adjust duty policies in light of COVID-19 and also adapting our policies, noting some of the difficulties that many of us had around duty since the very beginning.
I think something frustrating for the graduate RAs specifically is that we did send our concerns throughout the summer, and we also addressed in another letter more concerns that we had. And we have seen some changes, like we have a barrier for residents now between the RAs and the new residents moving in. But I would like to note that that barrier and some of these new precautions came about less than a week ago. And we have been actively moving in students throughout the summer. And now what we're hearing from the undergrad students sounds very familiar to our first letter. So it's just frustrating for the graduate students to see that we did send some of these concerns, and now we're months later and the undergrads are now having their move-in, and it just kind of sounds like the same story again.
And I would like to add, when we talk about duty, be aware that tonight RAs will go on duty with no PPE apart from a mask provided by the community. Like, we're going to be in these buildings tonight on duty, some of us that a ton of new people moved into. We're going to be walking every floor. We're going to be in every area that we could possibly get coronavirus from. And so, like, these are not measures that can wait. This is real for us every night and every day.
And given that, like, so it's already 8:02, so can there be a meeting, another one of these meetings, like town hall meetings, where we can talk to you within the next week? Because otherwise, I don't know if I will continue with my job or with this position or this role, because I just don't, like, it's just not really transparent at all, and like how I'm viewing this. So can there be a meeting within this next week, because movement is happening now, and like we're on our duties now? So yeah, or even like tomorrow. And I just want, like, just to answer that question that I just asked.
I would also like to say that throughout this whole housing process, a lot of flexibility and change has been required of RAs, starting from the minute that dorms were closed and some RAs were moved into West Quad and required to still continue their duties and their responsibilities. And then those same RAs were also told maybe 12 hours before moving that they were going to be moving into a new house, had to change everything. But we continually don't see a lot of that flexibility and that change and that help happening on the other side. Like, being told that we appreciate your help, we appreciate your changes and how your understanding of things isn't really helping. It's kind of like thoughts and prayers, and that's really not what we need at this time during a pandemic. And I would just really like to see there be more ability to change in the ways that was already expected of us, just kind of having that expectations go back and forth, because as we know in this housing position, a lot is required. And I know room and board is a great compensation, but in this current America, in corporate America, we should, and the way you guys are preparing us to be in corporate America and be leaders and best, we need to keep that same kind of mentality, even in this position.
Can I also add that a close friend of mine was recently an RA in a building that was shut down, and she was told by facilities asking her when she was going to move out before she was told by any LT or any upper housing. And I think that is quite, like, honestly unfair and kind of ridiculous that even though you have made these decisions, other people are finding out before us when they directly affect us and our well-being.
I think the bottom line is that this town hall has proven that this conversation we've started tonight cannot end here. The success of our public health informed semester will depend on this conversation continuing and your continued commitment to listening to our complaints and taking direct action, not thanking us.
May I request that the next meeting, if there is one, be in a format that goes through the letter that we have sent and answers all of those questions bullet point by bullet point with no fluff or BS that we've kind of had tonight. And then the second half of the meeting be to answering our questions. I've been a little bit frustrated that the last 15 minutes of this meeting has more or less been us asking question after question and not really been able to get answers because we had a time restriction put on us that we couldn't really adhere to because the first half of this meeting was introductions that may not have been as necessary as they seemed at the beginning.
Yes, I think that, as we have talked about, having another meeting is going to be very important. And then for us to be able to go through the letter with a little bit more time to be able to answer every single point. That has been our intention all throughout, or since we've received the letter that you all sent. And so we want to make sure that we do that letter justice and be able to take the time that we need to be able to formulate our responses. We are also, and I just want to acknowledge, we have heard what your concerns are. I don't know if you've been paying attention, but we've all been taking notes on some of the things that you have been talking about or saying. And we plan to regroup first thing in the morning to be able to really think through a response for you all and to be able to take action where action needs to be taken. So do just want to, again, I know you're tired of hearing it, but just to say thank you for providing some of those feedback and points to us.
One more point on kind of the discussion around facilities and janitors. I believe somebody in another dorm had let me know that they discussed with their janitorial staff that their janitorial staff was at half capacity. And typically it takes 6 weeks for them to clean the building, yet they were only given 2 weeks to clean the building. Even if this is only half true or partially true, it seems unacceptable to me that the university decided to cut corners with facilities going into a COVID-19 kind of living situation. And I don't understand why the university didn't spend more money hiring extra janitorial staff rather than allowing us to move forward with less janitorial staff and less time to clean the buildings, and then expect us to move into a building infested with bats or rats and different issues that clearly should have been taken care of weeks ago while the buildings were being cleaned.
I'll address that. It is true that we involuntary furloughed part of our staff through the summer. It's also true that we carefully managed the dates of when they were coming back and rotated our staff around so that we could get to clean all buildings prior to the students showing up. And in my mind, was a fairly choreographed event that culminated with us being complete before the students made it. With regards to the bats and rats, not familiar the specific of the rat. I am aware of one bat that we removed from a residential hall.
I've personally removed one bat. I've also had 2 others, and we had one resident have rat poop in their bed today when they moved in. In regards to cleaning facilities before residents moved in, I believe that my own bathroom was not clean when I had moved in, and I know of other RAs whose bathrooms were not clean for days after they moved in. So I understand that you mention residents as if RAs are not actually a part. So I'd just like to voice that as a huge concern that we are moving into spaces that were not clean. And I don't understand how you expect us to be comfortable with cleaning standards that haven't been met all summer and then telling us that it's going to be perfectly safe when you couldn't even handle it when no residents were here.
Appreciate your comments. Hopefully, though, there's some logic in your mind with the fact that no residents were here. So at that time, we weren't doing cleaning. But to your point, the residents, the rooms for when the RA showed up should have been clean, and I'm responsible for that.
I believe my point was that it should have been easier to clean the buildings when residents weren't here to prepare for move-in. And then if you couldn't actually clean the buildings when no one was here, I don't know how I expect the facilities to be able to handle this while residents are living here and actively making messes every day. I'll yield my time. Sorry for any of the RAs who've had to listen to this.
Also adding on to that, I think one of his bigger points was that the more important point was that it was not clean when we moved in, and that we, for some reason, are not being categorized as residents of these communities when we are, and our health and safety should be as important as the students moving in later.
I agree. And again, I'm responsible for that.
I'll also ask that if we do have a future meeting, which it sounds like there will be, that it be in a format that is conducive to being able to see what questions are being asked, because this one, everything's being very much streamlined, and because we have concerns about retribution because of the language in the LOA, we're not able to show our faces. And so being able to see that there is a solidarity in the types of questions or the quantity of similar questions that are being asked would make us as RAs feel like our voices are larger and actually shared by our fellow Res staff members.
This is all really good feedback. I also want to be able to remind you all that we're going to get together tomorrow and figure out when our next meeting would be, but we do hear you that you would like to have one this week. And we also know that putting together that letter and the response for you is top priority for us. And so we hope to be able to have that out in the next day or so.
I also was wondering, is there a reason why the hall directors aren't here today joining the call, or even like some of them? I just was wondering.
Yes, so what we wanted to do was make sure that we heard directly from you. And so we invited all of you to this meeting, and we did not invite the whole department to the meeting because we felt like it was really important for us to hear through you personally rather than through your supervisors or the supervisory chain. So this really wasn't meant to exclude anybody. It was really just an opportunity for us to hear from all of you.
In the future, I think we would really appreciate having our HDs on the call. It's hard for them to be in the loop of what's happening with us when they're purposely excluded like that. They can be on a call and we can still talk as well.
Yeah, personally, I feel like a lot of us have made really great connections with our HDs, and talking to people who don't really know us and don't really know what these changes may have done personally to us isn't that great. For me, being in Bates, my whole Res staff are the main people who know what we're going through and know what changes because they see us day to day. So I personally would love if hall directors were here, as they are the first people to know us.
Agreed.
Appreciate that feedback.
I would also like to mention that I think someone talked about having another meeting this week, but I would like to say that you guys as upper level staff should understand that this is not a matter of weeks. We need to have this stuff done and in days, and we need written responses, and we need more communication and more direct responses to the questions we ask and the points we have.
Yeah, just to add on to that, like this is just, I haven't spoke the whole time, but I feel like from housing, like it's easy for us to be told to do things quick. But when it comes from us requesting something, it's drag or it doesn't feel like it's that a priority. And like when this is a life and death type of thing, and I just appreciate, like, I know you guys are saying like tomorrow, but I really want to see like this tomorrow or in 2 days. Like, I don't want to hear, like, I'm sorry, I just don't want to hear like, yeah, 3 days, we're working. I want to see like actions, like things happening, like answers and solutions. Not we hope, we're planning. Like it needs to be done. So that's just how I feel at this time.
Speaking to solutions, I think it could be really helpful for RAs to understand that if, in fact, we do need to be sent home, that we know ahead of time what the plan will be, because last semester was incredibly frustrating with the upper management basically telling us that we had to quit if we felt comfortable, and then every single day having changing information. And I understand that that was before we had the information that we do now. But if we don't have any sort of transparency of what that is going to look like before shit hits the fan, if it does, then I believe it's going to be fairly similar to last semester. And that makes me incredibly scared and frustrated because I'm going to have to find housing, and I know many other people will. So if that's possible to release any information, at least to the RAs and hall directors, of how that's going to look if it needs to happen, that would be great.
We really would want housing as a backup. If the dorms get shut down, we want guaranteed housing, that ResStaff will have housing, because people do not have healthy home lives. People do not have funds to just go get an apartment, and people take this job with no pay, with the guarantee that we will get housing and room as board as compensation. So you guys should not just brush that off. That is a main concern and so stressful to all the RAs every day when we hear about more and more colleges getting shut down. And you guys just say to us, we aren't planning for a pivot and we don't have any plans for that.
It's also, with all of us being honest, that's the main reason a lot of people won't join in to speak out. It's not because some people are fine with what's going on. It's just, I don't want to lose my job because I don't want to have no place to live. It's kind of like what's being dangled, having your job being dangled in front of your face will really make you feel like you can accept a lot of things. But I just want to make sure we're all sure and being honest of that. Whoever's not in this meeting is more scared than they are okay. So moving on.
I want to acknowledge that we do hear all of you. We hear some of the fear in your voices, and we want to make sure that we are going to respond appropriately. So at this time, I'm noticing a lot of people are jumping off the Zoom call. I know that we've gone over a bit. Happy to stay if anybody needs me to stay, but just know that as we regroup tomorrow, we'll make sure and send out information about some of the action items that you had all put forward. We want to make sure that we are being as transparent as possible. So we will set up another time for another meeting. We will make sure that that happens this week, and we will respond and get back to you all about when that next meeting will take place. So I guess in closing, I just again want to be able to say thank you to all of you for joining this call. I know that you want more than a thank you, and so we will work very hard to make sure that that happens, and that we get you everything you need in order for you to feel safe in the community.
Just real quick, I think it would be best if the meeting could take place within the next day or two, just because we do want to give you guys time to consider everything and get a response together and think through logistics and everything. But at the same time, move-in is still happening, and a lot of people are worried about being exposed without PPE or the sufficient PPE. So if it could just be done as soon as possible, maybe even earlier than just sometime within the week, that would be great.
All right, thank you.
I also would like to say that there are still 105 people in this chat, so it's obviously still important to a lot of us. So if you're able to keep talking tonight, we would love for that to keep going right now.
Yeah, we want this worked out. I don't think this has necessarily soothed anyone's thoughts or made us feel better about the concerns we sent.
In fact, I think that most of us probably feel immensely more frustrated by the lack of direct answers, direct responses to questions that have been asked, and the letter as a whole. We're mad, and yeah, we want direct action, not dancing around the question.
And because you had raised your hand, did you want to say something?
Yeah, sorry, I had to unmute. A couple of quick things. One is that certainly we did hear you. We got the information, I think it was just about yesterday. And so we're trying to work to get the answer for all these things here. Many questions to answer. Some of them have to be verified with many different folks and stuff. We're working very fast to get some of those answers. Hence, it just takes us a little bit more time to get all these answers. I'm not trying to come up with an excuse. I'm just telling you that you ask a lot of good questions and you deserve to get good answers from us. And so we're working on that. And certainly as soon as we get to get some of these answers, I'll make sure that we have another meeting, hopefully in the next couple of days. I do have to ask a question though, because in my mind, I'm trying to figure this out. Folks, I keep saying we don't have enough PPEs. And we've been hearing that we have the masks, we have put on the sanitizing products over there, put signage out there. If I can get a better understanding also on the rest of the team here of what is it in terms of PPEs or lack of it that you are looking for, that would be most helpful. And then also remind you that somebody asked the question, how come we didn't have a lot of these things before? The supply chain for PPEs across the country has been such that that there wasn't much of that available last March, but a lot of that is available now. Our goal was to bring all those things here by beginning to mid-August, which we have done a lot of that at this point. But it'd be helpful for us to know what are the PPEs that you're missing so we can immediately work on that.
More masks for ResStaff. We have 2, but we were told in our training that you can only wear one and then you immediately have to wash it. And obviously we live in U of M housing and you have to pay for every load of laundry you do. So we can't wash them every 2 days. Face shields, we want plexiglass in bathrooms, even though you said we can't do that, we would really like it. We would like gloves distributed to all communities, not sporadically like we have now. And we want, again, more hand sanitizer in more places. And that's not everything. That's all I can think of right now.
Grad students also want face shields, and we only get masks when we work at the CC. And at one point we ran out in the summer and we didn't have any for, I don't even know, maybe a week or 2. So yeah, there is a possibility of things running out.
Speaking of masks, I don't know if I. Speaking of masks, I just want to say that I know personally I'm working 8 hours tomorrow, and then I'm working and was originally scheduled for another 6 the next day. So 2 masks is not enough to work that much, and I was originally scheduled for 25 hours this week. If I didn't bring my own masks or have my own masks, then I wouldn't be able to have proper protection because I was only given 2. So I think that's also a big concern, kind of like others have said. It's not just that we only got 2, it's that we got 2, but are also expected to work hours and hours and hours on end every day during move-in especially.
Good, thanks.
So again, if you all just let us regroup and then make sure that we can respond to all of the items, the action items that were in the letter, and then take some of the information that we heard today and formulate a response, we would really appreciate doing that. So at this point, we are going to end the meeting and know that we will get back to you with the date and time of another meeting and as well as a written response for all of you.
As a final thing before you end this meeting, just to be clear, we did send you this and ask for a written response and ask for you all to know these things before this meeting. We said we wanted 24 hours for response. So it's kind of frustrating that we had to have this Zoom call and have it go this way for you guys to say that that's what you're going to do now.
At this point, we did receive your email, but late last night. And so when we were able to come together this morning, we really wanted to make sure that we had time set aside to really hear from everyone as we were starting to pull all the information together. So it's not as if we haven't started pulling together information to respond to your action items. We just knew that we probably wouldn't be able to do a thorough response within 24 hours. So wanted to give the opportunity for all of you to be able to share some additional information with us or tell us anything else that you may have wanted to share.
Is it possible at the next scheduled meeting that we can have like a written agenda that goes through both the graduate and undergraduate students' action items, just to make sure that we can really avoid people like concerns about it not being addressed or kind of the small talk in between. So really having an agenda set up for us to walk through.
Yeah, yes, thank you. Oh, Martino has something else to add?
Yeah, no, my suggestion would be that the agenda flow with your points, your request. And, all of those items, we're going to be honest. We're going to tell you what we can do or what we need more time to do and what is reasonable. But, for example, I said a couple of times that there will be no retaliation. Well, there will be that'll be in writing on that so that you can all see that clearly. And that way we won't have any confusion and there won't be any fluff. We'll be really direct and give you our responses because that's what you want, that's what you need, and that's what you deserve. So that way we're not just sharing information, responding directly to what you listed.
If we can just moving forward with housing in general, if we can have more transparency before any meeting starts, not just ones where we're furious, of what kind of information you can or can't give us at that time, I believe a lot of us would have been a lot less frustrated had the email you sent us about this meeting said, hey, we don't have all the information. This is the information we have. This is what we expect out of this meeting. And we'll have another meeting tomorrow or in 2 days where we can actually answer your questions, because we all expected our questions to be answered and all of you to actually know what was in the letter. And so it's infuriating to come into a meeting where we have expectations that are not met in any way, shape, or form for at least the first 45 minutes of the meeting. And that is not just for the upcoming meeting that we have, but that is for all of staff, for all meetings that we've had, that I've had in the last 4 years working for y'all. But thank you for your time tonight.
Also, just real quick, I just wanted to know if you guys knew when you were planning on sending out the email with the written statement protecting us against retaliation, just so we know this, we know when to expect it, like the time that it will be sent out to us.
I can send that statement out first thing in the morning. It'll be the same thing I said tonight. It'll be clear. So if you want that statement by itself and not with the other items, I'll be happy to send that first thing in the morning. I'll send it to the combees and the staff, and they can forward that out. No problem.
I would also like to add real quickly, I know I've been a little bit quiet tonight. Again, I'm very new to this position, and I don't know all of the documents and whatnot that are being referred to, that as we're making comments, people are referring to documents where evidently there was something in writing that talked about jobs being put in jeopardy for different reasons. I want to make sure that people understand that I'm committed to reviewing those sorts of documents and making sure as we move forward that what we're learning throughout this process is going to be reflected in those sorts of documents, so that there isn't confusion and that there is clarity. I've had the good fortune of working at other institutions where we have very high performing teams. And I'm not saying this just because now I'm the director of housing at the University of Michigan, but what I've seen in the last couple of weeks, this is a high performing team. And the fact that you all are coordinated to join in, I think at one point I saw where there were 118 people on this chat. That really is exciting to me about what our future is. Is it comfortable for me to sit here and listen to this on my first day on the job? Absolutely not. But this is what I'm here for. And I want to make sure that you understand I'm going to make a commitment to work with the housing team, with Dr. Harmon, with Cambees, with other partners, to make sure that we're addressing, as Dr. Harmon said, the issues that we can. But I also, I'm going to be as honest as I can with you. Some things we may be able to do, some things that you've had in your, or that you've listed in your demands, may not be the answer that you would like, but we're going to give you the answers that, you know, that are appropriate today, or not literally today, but as we're able to answer those or give those responses. So, you know, I again, am optimistic about our future and how we're going to be able to hopefully, we can't go back and change anything from the past, but I'm confident moving forward, we'll be able to make some very positive changes.
Hi, Rick. Thank you so much for that. I just wanted to tell you real quick, at the beginning of every year, the RAs sign a document called the LOA, the letter of appointment. I feel like everyone on this call has been acting like it's ridiculous that we're so scared of retaliation, but I'll read you real quick an exact quote from the LOA that says, "I will not participate in discussions or activities that in any way disparage my colleagues, supervisors, the department, or residents, as doing so can negatively impact residents' trust in and perceptions of our staff members. I will show public support for all ResStaff decisions and University of Michigan housing policies and will not undermine decisions that are made. If I disagree with a policy or decision, I understand that I am encouraged to provide constructive feedback to my supervisor or ask clarifying questions while continuing to enforce the policy unless directed otherwise." And that is only a small portion of the LOA that clearly is meant to make us feel as if we ever say anything against housing, we will be fired or we will be at risk of losing our jobs. And not only our jobs, but because we're RAs, our homes, our access to food, and our access to schooling. So it's not like, it's very serious for us. It's really, really serious for us. And I think that, and including in the social media policy, which further enforces the way that we cannot discuss with anyone else on ResStaff or anyone else on campus on any social media platform, any complaints we have. I think that some of us are scared of losing these jobs. Some of us are scared that campus is going to be sent home and we're going to be treated the same way we were last semester when we were given literally 1 day to move out, or at least felt like that, which housing later clarified after the deadline that they told us we would have to move out, that we didn't actually have to. I just think that the importance of this to us cannot be understated. And we are not feeling scared and targeted by the language in the LOA for no reason. We are reacting this way specifically because of housing decisions that have put us in this position.
Can I follow up on that and ask, I know you said that you're very new to this position. I understand that. And I also understand that you might not have had the chance to go through the LOA and understand where we're coming from. Can we expect within the next few days or the next week to see changes to the LOA? We know it's possible because a lot of us have faced those changes lately, but especially language like telling us that we can't talk about our experiences and our feelings. I feel like that is something that inherently goes against ResStaff values that we have been taught throughout our entire training, throughout ALA 421. We're taught that our experiences matter and that all experiences matter, but that's not what we're seeing right now.
I also would like to point out that I know personally I asked if this meeting could be recorded, and I would not be surprised if other people have, and it was denied to be recorded. And I believe one of the things that we were most worried about is retaliation to losing our jobs or anything like that. And the reason we asked to have this meeting recorded was specifically so that it was in some form of documentation that you have said tonight that we are not going to have any retaliation. Saying it's in writing tomorrow isn't great when we just spent the last hour and a half discussing about this, when it very easily could have been recorded from the very beginning. So I just would like to point that out, that there are lots of ways to kind of actually make change rather than just saying we will do it later.
Camby's.
Thank you so much. Two things. One about the LOA. We definitely will look at that as soon as possible and see what we can do with that in the next few days to a week. I know Rick is new, but that's one of the things that I'm looking forward to seeing him contribute to our department, and so we'll definitely address that issue as soon as possible and let you know what we can or cannot do. And then regarding the recording piece of it, again, 24-hour notice, not enough time to kind of communicate. And so we were discussing last minute emails exchanged, and so we just didn't get a chance to make a decision one way or the other. Certainly, we will then discuss that with more time for our next meeting this week and put that under consideration. Thank you.
I would just like to, I know it's about to end, but with the 24-hour notice thing, that's something that was expected of Bates RAs like a week ago. So obviously this is something that housing is okay with letting people have. And it's not just, it wasn't just writing a letter. It was, hey, you're gonna live somewhere completely new. We don't care if you want parking. And I know that some people in my community were told verbatim that parking and different things were safe for real RAs, which isn't great to hear. So I know in housing, we've been doing a lot of things that are random and not given much notice. So you can't really get mad at us for that happening because it kind of seems like that's the standard currently.
And then going off of that, I don't understand, like when I got that call last week, I don't understand why it was like a no caller ID. I wasn't going to pick up that phone call until someone left a voice message. Like it was very unclear to me why they were hesitant to just straight up call me without hiding their identity.
I can respond to that. Most of the staff have been working remotely and so not on campus to use a campus phone number. And so when they're using their personal cells, many people have blocked the number because these are our own personal numbers. But I think you do bring up a good point about transparency and that also includes phone calls. And so we'll work with the staff on that because I think that that is important. At this point, we are going to wrap up now. And so just to reiterate, we will be getting back to you very quickly with the statement of non-retaliation. We will also make sure that we are going through your letter of action items and responding to everything that you put in that letter. So again, thank you all for showing up and thank you for sharing all that you have. And we will be in touch. Bye.